So what do we get for all our money? Clearly, we do have the most expensive health care in the world. Do we have the best health care system in the world? I mean, I think a lot of us tend to believe we've got the best health care in the world right here in the USA. If so, then you ought to be able to measure it. You ought to be able to prove that we've got the best health care in the world. So you can look at life expectancy. So here we are with the United States versus an array of these same countries that we've talked about before. And in the United States, the life expectancy is not as good. Our life expectancy, in fact, we're ranked 27th in the world in life expectancy, right after the Caribbean island of Barbados. So they live better in Barbados than they do here. So that doesn't look so good for our healthcare statistics, for our outcomes. Infant mortality. Well, we're pretty bad on infant mortality. Here, tall graphs are bad. You want low numbers on infant mortality. And here, we're ranked 36th in the world for infant mortality, behind Cuba and Taiwan. So the World Health Organization does a global ranking of healthcare systems, and they try to draw all the data together that they can. And at the top, they rank France and Italy, and the U.S. ranks 37th in the world, between Costa Rica and Slovenia. I'd hate to have to find Slovenia on a map. So, there's this riddle. How do they do it? These other wealthy, industrialized countries, all of them have some form of national health insurance. They all cover 99 to 100% of their population. They have better health care outcomes than we do, and they spend half as much money as we do. Well, the reason is they don't have the private insurance industry that we have, and they run their systems much more efficiently in ways that they can achieve efficiency. So, a few more slides. I know this will all be on the test, so pay attention here. I know it's kind of boring, all these graphs. How do they save all that money? Well, we try to save money in this country by kicking people out of the hospital pretty quick. If you get sick, you may get out. It's hard to get in the hospital. You've got to be really sick to get hospitalized. And then, once you're in the hospital, we try to kick you out pretty quick. So maybe these other countries kick you out even faster, make it even harder to get in the hospital. No. Turns out all these other countries spend more time in the hospital than we do. Well, maybe they save their money by not having enough nurses. Nope. Turns out all these other countries have more nurses per capita than we do. So that's not where they're saving their money, is on nursing care. They've got more nurses than we do per capita. Well, this is an interesting slide because they polled doctors. The percentage of doctors saying that outside review to control costs is a major problem in their practice. So ask doctors, are you hassled to try to keep costs down? And the U.S. had the worst. 37% of U.S. doctors said they were being hassled all the time to try to keep costs down. And in these other countries with these so-called terrible government bureaucracies leaning over their backs, a much smaller percentage of doctors complained about practicing in those countries. So they asked people, can you get into the doctor when you need to see one? And here the United States did worse than all of these other countries. 28% of people in the U.S. said they had trouble getting in to see a doctor. So this slide really answers the question, which country rations health care? Well, I think the United States is the country that rations health care more than any other country. It's harder to get in to see a doctor here. So maybe we can blame it on something demographic. Maybe that's the reason. Blame it on old people. That's always a safe bet, you know, blame it on old people. Well, turns out you can't blame it on the old people because all these other countries have more old people. We know old people are expensive, but we can't blame them. You know, they spend half what we do, they have better outcomes, well, they have more old people. Can't blame it on the old people. Well, maybe it's something else like smoking. Well, if any of you have ever been to Europe, you know how much they smoke in Europe. I mean, yeah, we smoke too much in this country, and we do smoke a little bit more than the Canadians, but all these other countries, again, with better health outcomes than us, they have more smokers. I could show you similar slides about overweight. We're not the heaviest country in the world. There are a lot of countries that are heavier than we are, particularly the Germans. I could show you slides about alcohol. The Europeans drink a lot more alcohol than we do. So it's hard to find a demographic reason to explain why we do so badly and why we spend so much and why they spend so much less than we do. Well, maybe it has to do with high tech then. So you can try to look at high tech care. Maybe we get all this high tech care. They don't get enough high tech care in these other countries. Well, one way to look at it is MRI units. And actually here we're just kind of in the middle. We've got about this, we're in the middle of the range for MRI units per population base. So it's hard to say, you know, that's not how to explain this riddle. But what about a really high-tech surgical procedure like kidney transplant? Well, again, this is all per capita. In the United States, they get fewer kidney transplants per capita than they do in Canada. So in Canada, and actually in Canada, they get more heart-lung transplants. I mean, heart-lung is an incredibly high-tech procedure. Higher rate in Canada than the United States. So in Canada, they're able to get the high-tech stuff done. So the problem is, we've got a system, you know, we call it a healthcare system that probably would be better described as a non-system of illness care. Our system is really fragmented, and I describe it as a dinosaur heading for a tar pit. I mean, it is collapsing around us, and we don't understand that because our judgment, our vision is clouded by all these myths, and we think that we've got the best health care in the world, but the fact is, if you don't have insurance, in the United States, you basically live in a third world country when it comes to trying to get health care.